Hello, welcome to Joe's Denture tutorial videos. Today I'm gonna show you exactly how to set up denture teeth, upper and lower denture setup. Gonna set this denture from the start to finish for you to learn. And normally setting dentures takes about 1 hour or 45 minutes for those who have done it before. There are people who can do it for 2 or 3 days. If you do it at home in practice, doesn't matter, take your time, so that way you can do it correctly. So this is already articulated, with this kind of a by registration here. It's a small, which normally could be 2 of them. The reason why it is over closed is because it's being used only one. So with 2, it will have the mandible slightly in the right place, but that doesn't matter. So when you articulate, you have to make sure you pin. This is the pin. This keep your articulation in place without moving, because you cannot allow your articulation to move. This is a fixed articulator. You can only do certain movement with this. There is a semi-adjustable and there is a fully adjustable articulation, which I never used the fully adjustable before, so I'm used to work with those. I was told that people can do their own kind of selective grinding and all those type of movement in their own dentures. So the back, forward, side by side, all this type of articulation. So in some places, some doctors together by registration with a face bow, some kind of a device they put in a people's ear to kind of like find out. So I don't do that. I'm just gonna set these dentures the most simple possible. So here I will. So as you can see, this bite might not be correct bite. Maybe the person is slide to the left. Not sure. We might have to see that on a bite block. So as you can, because she's hitting on the condyle right here, it should not be hitting. So it might have a slightly, but it's the matter of knowing and the wax trying. But as you can see, also is over close. If this person have this denture, you're gonna see that her smile is not noticeable at all, that she looks sad, or he looks sad, that his face is so kind of wrinkled because it's over close. So if you take the millimeters ruler and start measuring from this borderline out here and all the way in here. So you're gonna put your ruler here and all the way up here. It will tell you the exact measurement, which is about 26. It's measured about 26. It's too overly close. This person needs to be about 40 millimeters to, or 42, depending how you want her to smile. If you want to open up, so when that person talks, you can still see teeth. If that person is smile, you can still see teeth. It has to be in the right position of a 40 or 42. It's about 30 over here. 40 is too much, probably. That's So I opened it up. Now this person will be able to see teeth when talking. It's about 40 millimeters right here. It's about 40. And then I'm gonna use Baseplate. This is my so this is a custom Baseplate. So Baseplate gives the sense of the patient or the person, the feeling of the real denture, you know, that kind of a heart, and keep the teeth in place without moving. So this is really hard acrylic, which you have like the cure light cure, you know, similar to any light cure out there that you can see. Females use light cure to cure their nails. So this type of acrylic, is cures with a light, which is makes it hard. This is called well, the terminology or Baseplate custom tray. That's what is used. So custom tray Baseplate, it comes in this type of container, really dark, because it's sensitive to the light, and it's also really soft. It comes on the sheets, you know, soft. If you leave it open and exposed to the light, it will cure, it will set for you, you know, it will like get hard without you knowing. It's already hard, so it has to be really well taken care of. So what I will do here, I will make sure my midline, remember your midline, this is how I do my own, this is how I do it. There is other technique out there that I don't know much about. I'm just gonna talk about the way I do it. This is the line it is in your body, you know, divides the center of your body, you know, all the way through you know, the horizontal, vertical, everything. So this is the line that goes through the middle of your nose all the way through your eyebrow. So that's how I do my midline. I leave some marks for me to look at when I'm setting the teeth. I kind of picturing the person, the face of the individual, while I'm setting the teeth, where her face is, where his face is. Just kind of close my eyes every now and then to kind of picture that image, where they're located. You see a lot of dentures out there with their midline messed up. Well, patience is happy, and that's what is matter. So I don't like to have a crooked type of a denture. I like my dentures to look really nice and correct. I'm just gonna talk about me. Every technician has their own way of setting dentures. I'm not gonna fancy talk to you and talk about terminologies and all this. In the end, we have the same results. I'm not using any other technique other than my own. There's other technicians out there. They start with the lower. I start with my top. I'm just putting this wax here to kind of like stick on my teeth. Stick my teeth to it. So just here we go. And start with my central. Start with my central. I'm not grinding because this is a second wax drying, and the teeth are already grind. Normally you have to kind of rough them up, rough it up, and to create that kind of a bond with your acrylic. So this one is not quite Just gonna grind on the teeth. You're not gonna get used to this really easy. Grinding teeth is really not hard, complicated, because it can fly out of your mouth, out of your hands. It can fly out of your hand really easy. For me, the hardest part of setting teeth is set the first two teeth, because for me it's like there is the whole they have to look just right. It tells me where the denture's going. Where the dentures is, where the face is gonna be. That's the more slightly complicated part of it for me. As you can see here, so yeah, I feel comfortable with this midline. I feel comfortable with it. You know, the chin of this person is kind of like sliding to the side, but the midline is not gonna, you know, I can reassure you, this is where the center of the face goes, right when I have that midline right there. I can argue that whenever we can go to China, we can go anywhere, and I will stick to my own belief in the skills and the knowledge. That person should not tell me, oh, my denture was bad, my denture was crooked, my the teeth is not, you know, no. Maybe your face is, but I am right, you're wrong. I am right, because the midline is right where it's supposed to be. Maybe you had a stroke, or you might have some type of face deformity, or you used to look at your face any other way. But this midline, it is not wrong. It's right in the center of your body. It should not. Of course, you have to do what the patients ask. You have to. You don't have to. You know, you have to give what people feel comfortable with. So if you're doing this at home, you know, try to get this midline right where it's supposed to be. Make sure your teeth are lining up, you know, right there with the lines that you have drawing. You know, make sure so that way your denture doesn't look funny when it is in the patient mouth. You will see a lot of dentures out there, even in the pictures with the messed up midline. You will see a lot of dentures, even in the books, lecture books, with the messed up midline, because the whole technician has not mastered putting the midline where they're supposed to, you know. So sometimes the doctor marks the midline in the area that he think where it goes, but it actually doesn't go there. I trust more that line than anything else. I always go by it. So if there is an argument between you and your doctor, so just tell him what you think. Theoretically, that's what the midline is, in my own belief and opinion. So I'm putting my laterals on, as you can see. Don't worry about when you're setting dentures. Don't worry about fixing the teeth right away. You can get back to those later, you know, do your corrections. It looked messy, it looked waxy. I mean, some people are more neater, I guess, but I don't pay attention to that. I just go ahead and keep on working. I'm kind of like grinding that teeth because it's not fitting in my base plate. It's slightly weird and bulky in my base plate because the base plate has a few millimeters thicker than the person tissue. It still looks slightly weird, funny. I'm just grinding in the areas where it's making it feel slightly off. Just putting my camera up a little bit so you can see what I'm doing. Remember, you need a torch to do that. I'm have my torch on my side. Putting my laterals on. You see how the teeth lining up. So, and then I will find the plane, the occlusion later. I'm just putting my teeth all where I think where they go. All of them. On the denture, if you are looking for a job somewhere and you're a technician, an affordable denture, you need 1 hour to set a teeth. And Aspen Dental, they give you 2 hours. Make sure you do your movements like forward, back. Make sure that your teeth touches in the area they're supposed to when you do all this movement. And because they will count that when they kind of looking at your setups, which is ridiculous because that's not the case in the real world. So I'm putting my laterals on. I mean, no, my bicuspids. Sorry about that. So I'm putting my bicuspids on. Premolars. You will see in a few minutes that this denture is taking place. Right now it looks slightly weird, but it will look good. I'm doing the resets and putting the denture in the base plate. You can do all wax base plate too. I can show you that in a different video and how to do it. If you're in a hurry, you don't need to do that custom tray material thing. So as you can see, I already put all the teeth on it. You know, the next thing you have to do is make sure you're gonna have to have a plane of occlusion like this. Plane of occlusion. Make sure it's clean. Take all the wax off of it. You know, you have to take all the wax off of it so it doesn't interfere with anything. So you're gonna do that twice. I do it twice. I check my occlusion twice. It's a lingualized occlusion. There is a lot of fancy terminology when it comes to setting teeth and a lot of rules, you know, but in the end of the day, those rules, in my own experience, doesn't really matter. If the denture is bad, it's bad. People are not gonna be happy with it. You know, they're gonna complain and they're gonna tell you this is no good. I can't eat with it. You just snap one side to another. It's horrible. It's terrible. You know, people are honest, and it will tell the dentist the denture is not good. So, you know, there's those rules. I'm not gonna talk about those rules with you because, you know, for me, they don't really matter. So, you know, like the rules of the curve of speed, you know, the curvature of the denture has to have this degree here. You know, I'm sorry, I'm not gonna talk to you about that. I'm just gonna make it simple for you to do it at home. You know, so you don't need to go to school to learn this. That's easy. So, I know that there will be some haters out there on this watching this video. They're gonna say, "What the heck this guy is doing?" You know, because they, I guess, consider themselves better. It's like I play guitar, I play trombone, and it's like a music. You know, when everybody execute notes in a different way. Everybody plays differently. And every day you're learning new things, and that people, you know, just like have their skills in a different way. So, but then in the end of the day, they have the same result. So, by the way, if you're new to this channel, don't forget to subscribe, and you will be able to see more videos and be notified every time I'm putting a new video on. Subscribe and hit the like button so then you can enjoy the learning of setting dentures or anything about dentures. So what I'm trying to do here is like making you warm up your instrument. You kind of like slightly make every single tooth to touch. Of course, the laterals you will have at least 1 millimeter higher than the centrals. You know, if you want to make your denture look natural, don't have all the teeth kind of lining up together the same height. You have to have them with a slightly of a kind of a mountains, you know, valleys and mountains like that. So, so far, kind of okay right there. For me, I can go to the next step. I'm gonna verify everything later. And one way to see how the smile is looking, you grab your thumb. The thumb, you know. Some people wear gloves. You know, that's the most dangerous thing to do, wearing gloves when you are setting teeth. Those are small, and you see this thing, it will eat your gloves and kind of like try to take your fingers off. I'm not sure why many technicians do that when they have to disinfect and wash the wax before they give it to a patient. You know, I guess we all different. So one way to verify you smile how it's looking, this is gonna be a black person, you know, my hands, I'm black. So, and the smile, you know, this is the lips, You kind of see that lip, a smile in there, you know. And when I put the lowers on, I can come up and do this, and you see how your teeth are looking, you know. If you has to move, if you has to rearrange the neck of the teeth with the thumb, you can even, you know, kind of like a picture the lips of this person right there just by looking. I'm not sure if you kind of be able to observe this. This is the lip, and you can see how your teeth are looking. So I like this smile. I'm gonna go ahead and do the lowers. So of course, for me to continue here, I have enough room. I'm not liking, I mean, this jaw sliding to the patient's left, and here this is the condyle right here. I'm not sure what's going on. I think the bite is not perfect, but I'm gonna try my best to make it look normal. So I'm gonna start with putting my centrals on. I'm starting with the lower teeth. Already put those two on. Gonna go ahead and put the laterals on. Somebody asked me today if I knew a dentist that can make someone dentures. Well, I told that person, I'm sorry, but do you know the dentists are not the one who makes the dentures? There are some dentists that knows all the basics information about the procedure, how to make dentures. There are some that they don't. I still believe that the dentists who were graduated from the dental school on the 90s, on the 80s and the 90s, they have a book, you know, they know because they went through those classes of making dentures. But for those who were graduated on the beginning of the new millennium, you know, up into now, no, because the universities, they don't waste their time teaching their students the basic knowledge of dental technology, because then it will take another probably a year or two for that student to, before graduation. What they do is they just have a one semester, you know, they make their denture setups, and then that's about it, pretty much. So I have worked with dentists that they don't really know anything about, you know, they have to go to training through corporations to learn how to troubleshoot dentures. You know, what's going on when somebody's whistling, what's going on when somebody talks with their mouth full, like they have like a whole bunch of food in their mouth. You know, all this troubleshooting, they don't have no clue what is going on because they don't, you know, they didn't take those classes. So well, unfortunately, us technicians know more, but we don't get the credits. You know, we don't. We just kind of like sitting there and you know, be okay with it. There are some dentists that they really appreciate, you know, what we do for them to make money. There are some that they talk like in a way to humiliation, you know, to humiliate, you know, you don't know anything, I am the one who, blah, 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 you know, the arrogance type. I have worked with those too, the arrogance type. But there are also some that they are really appreciate, they appreciate you, they come in and thank you to the lab, you know, they thank you, they say, oh, I really appreciate what you did today, you know, you made my day, you know, thank you. You know, so there are some dentists like that. So I'm putting my premolars on, my gas lower bicuspids. I'm not gonna talk with the tooth number to confuse you. I'm gonna do my premolars. My premolars on. I put all this wax on this so that way the teeth can stick really easy. I know I'm not good with the camera because I'm working here and talking at the same time. I want you to be able to see what I'm doing, and I'm sorry that if you're not able to see some of the things. I'm just shabbing this teeth underneath of the other ones. You know, you see, shabbing it in. I might lower this, close those gaps later, but I'm not worried about those gaps yet. You know, I will take care of that after I put all the teeth on. After I put all the teeth on, I'll take care of that. So I just worry about I'm just focused on putting all my teeth on it. It's like apparently looks higher than lateral molar part, but it's not, because this person has really, I had to cut this off. I cut him off because it was too long. They're not higher than lateral. If you are looking at my setups and look at, oh, they're higher than, no, they're not. I had to cut it. Because this person has a really high area on the condyle. Not sure. I don't want to short the dentures up. Maybe it needs for intention. And then there's that area here. This really concerning because it can start biting their cheek when they eating right here. It's too close to the bone. But I'm going to try to put a teeth in just for the try-on and see if will work. But I have to grind. Again, if you the first time to tune into this channel, don't forget to subscribe and hit a notification so you can be notified every time I have a new video. And you can share also, you can make your comments, and you can like the video. I'm just putting that tooth in there because this bite is questionable, but I gone ahead and do it anyway. I don't like the bite because it's kind of a slide. Just gonna fit this last tooth in. Again, I keep dragging this thing without you be able to see. So I'm gonna just follow this and then put another the rest of the teeth on. So here it is, the lower. I already set it up. I already set the lower up. It looks tight and everything looks good. Not sure what's going on. I thought I was recording earlier and then apparently wasn't. So you can tell that this needs a little bit more work. So what you do here, you get your plane and you put it in your dentures. Between, this is a plane of occlusion. Your job is make sure every tooth touches. Cannot be uneven. Every single one of your tooth has to touch. Just warm up your instrument and then start working to get them down, because sometimes the teeth moves when you working. They move, they tend to move. Like here in the lower, just push, just go underneath and push. Then you have to make sure they evenly, you see your interiors, there's a lot of void right there, you can see. Just push up. I normally like to use my knife, my bar Parker. It's pointy and has that little grip to it. Don't leave your denture like that, because you're gonna have somebody walk into the clinic complaining that when she bite, one tooth touches, another tooth doesn't, and a whole bunch of issues. On the same time, there are some people that they are hard to please. You want to have your denture feel like your permanent teeth. This is a prosthetics. It will never be the same. Once you lose your teeth, you lost it. Not even the implants are gonna make you feel the same. It will be a slightly new life. What type of quality of life? If you're not able to eat, chew, it's gonna be a not, how would I say it? It will be unhappy slightly ones. When it comes to foods, you know, you can be constantly worried about your denture when you're eating. They're gonna fall out and it's not working properly. You know, those are the issues of the nature of the denture. You constantly worry about it. So right now everything is touched, even the slightly cusp. You kind of look from inside, from the back, making sure everything touches from the back. Again, don't forget to subscribe and hit the notification, and that way you aware of when every time I load a new video. Make sure to straighten your teeth out to make look symmetrical. Yeah, this side over here I don't like it. The bite must be wrong. It has to be. Oh my gosh, my camera. It's kind of a slightly hard when you're just doing this by yourself and hoping the camera works every time when you move to a different location. So this is gonna be my first part of this video. It's probably boring. Am I boring you guys? But if you are learning, you're just gonna focus on learning and not to some other things. So this is kind of like, that's how school is. it's cool. You know, you just practice and practice and practice. It's just boring, yawning, and then that's the nature of this business. So what I'm doing here is gonna seal my teeth back together before I put the top back in occlusion, because I don't want my teeth to move. You have to seal it. I'm doing the hot wax to my right over here. I have a hot wax, liquid hot wax that I'm working with. Kind of smoothing these things out. Again, you can watch my other videos that have also video how to make your own denture, how to take your own impressions, and here also I'm showing you exactly how to do your own teeth setup. I know that there is other systems out there. I have seen a system of there is a teeth already together and use some kind of a weird material. I wouldn't trust material that is not sold here in US. I would rather try something else, but I guess some people trust some other materials and try everything to be able to smile. I think it's better to do the thing the right way. If you have a little bit of a time and patience, you can make your own dentures. You can practice and practice and do it correctly and buy the little things that you need to do it. You know, and that's what I'm trying to teach here. How to be independent. I go and spend hundreds of thousands of dollars at a dental office. So, but then if you're that type of person that is not a patient and you have the money, well, go to the dentist. All these things you can find it online. Everything you need to make a denture, you find it online. So I'm here, I'm kind of filling up all the areas that it was looking with a void, and then making sure the teeth hold them back together really good. Before I check the occlusion. Yeah, that's the nature of being technician. Being technician, I guess, is the choice of a career you made, and same way being a musician, you play the bass for some famous people. What credit you doing? Yeah, what credit you getting for playing the bass? What credit you having for playing the guitar? They might listen to you solo, but then who is really behind that guitar? I guess everybody knew who Van Halen was when he played the Michael Jackson solo and beat it, right? But other than that, you hear a lot of guitar solos out there and not a nice bass. You don't now have no clue who is playing, but you will know who's the artist is. You know, that's the same concept of being a technician, or being medical lab technicians. You know, the doctors takes all the credit. This tooth is touching here in the back, but I push it back. This is slightly opening by here, but it because once that I finish it, once that I clean up this wax, the occlusion should be really good. So I will smooth everything out and carve it for you to see the end of this triangle. So the wax triangle is done. If you can see, for the second try, this is the second wax try, correcting the issues. But I noticed that the bite might still be wrong because look like the left side is still like kind of sliding to the side. But we'll see how it will go. So as you can see, I think it's now doesn't look horrible. I cleaned it all out. I carved it. You know, as you saw, how did we start this? You know, the occlusion is good. The vertical is really good. So this is how your wax try should look like. You know, it look messy at the beginning, but at the end should look nice. Should look nice at the end. When you're setting teeth, don't worry about how the teeth look like. Should just continue putting teeth together. At the end, you kind of like looking to do the corrections. So don't be correcting at the same time because it's gonna take you forever. That should take just 1 hour. Some people takes longer, you know. But if you're thinking about taking this career seriously, you have to kind of develop a speed on setting teeth. You know, that's where the money is be a full technician, be able to set teeth. If you're doing your own at home, well, you can take a month to do it. You can practice and do it over and over. So this is gonna feel like kind of like denture because there's that hard plate over here that it will make feel like it's kind of a real denture. It's to stabilize the teeth, not having the teeth to move, and it's really a good thing to have. So again, don't forget to subscribe and hit the notification. And if you have any question, just send me any question right there below. And if you have any information, need any information about Just Denture Lab, I'm gonna leave a link right there in the description box. So thank you again. I'll see you tomorrow with another video. This is setting up a full wax try and up and lower denture.